everyone, my name is Maria Carcino, and today I'm going to show you the procedure of about IM, which is the intramuscular. But first, allow me to show you about the ampule and how to open it. Well, first of all, you have to check the doctor's order, check the medication administration record, check the label of the medication carefully to make sure to assure that the correct medication is being prepared. Do the 3 steps of the checking and not get tired of it, which is read the label of the medication when it is taken by the medication before and after withdrawing the medication. And also organize first your all the equipment that you needed to save some time. Now I'm going to show you the ampule. I had here the ampule. And also I had the 1cc syringe. I'm going to use 1cc syringe for now. And also I got antiseptic pad and cotton and also the band-aid for later on so I could use it. I also prepared my gloves and also the alcohol for my hand hygiene. I already organized the equipment that I needed. So now I'm going to wash my hands to avoid cross-contamination and also infection to my client. I'm going to prepare the medication, which is ampule and syringe that I'm gonna use for my patient. Using this gauze, I had the gauze here, and I'm going to break my ampule to open. I will wrap the ampule with the gauze to assure that I'm not gonna hurt myself. Now, as you can see, there is a blue dot here, so you have to face that blue dot on the top of the ampule. I'll show you. Wrap the ampule with the gauze, and then you have to wrap the ampule with the gauze, and using my 2 thumbs, which is this position, I am right on the neck of the ampule, and then the blue dot is facing on me. So I wrap this to assure that I'm not gonna hurt myself when I'm gonna break it. Just like this. Okay? And break it. Now that I'm break it, I'm going to dispose the top of the ampule properly. And an actual place ampule in the flat surface, or you can turn it upside down. Before we draw the medication from the ampule, rest assured that the needle from the syringe is tight, like this one. Because some syringe is you could make this tight. This orange part here, sometimes this one is could move or could remove, but sometimes this one is like right now is all tight and it's not even moving. So before that, you gotta check that, and then prepare that, and then that is how you prepare the ampule. Now, check again. I'm going to do the IM, which is intramuscular. And before that will happen, you have to check again the doctor's order, check the medication administration record, check the label of the medication carefully. You can check by doing like this. So to make sure that you're in the right date, right medication, right name, right age and dosage. And also do the 3 steps of by checking. Read the label for the medication, when it is to be taken the medication, before and after withdrawing the medication. Organize as the equipment needed, which is I got already here my syringe 1cc. I got my ampule open and ready to inject, and also I got my cotton, and I'm gonna use that cotton later. And then I also have my gloves, my alcohol, my notebook to write all the notes that I'm going to, all the notes that I'm going to do it to my patient. Now I'm going to perform my hand hygiene by simply washing my hands to cross contamination, cross contamination to my client. I have my medication and syringe ready, and also take note. Again, if you're mixing the vial or the ampule, rest assured that there is no water or there's no medicine on top of that ampule. You have to just tap it like this, and then and then you have to take out the syringe, take out the medicine, which is I already did earlier. So now I'm going to introduce myself to my client and explain the procedure. So on that way, she could participate and not got shocked of what's going on. Good day, ma'am. My name is Mark Garcia, your student nurse for today. And today you're going to have an IM injection, which is on the part of your arm, on your muscle area. Can you state your name, ma'am, and also your date of birth, please? Okay, ma'am. Let me see your bracelet. Okay, ma'am. Thank you. Do you have any clarification or any concern that you want to talk about before we're gonna start? Okay, ma'am. Thank you. Ma'am, is it okay to you that I'm gonna close the door so to your privacy, and so on the end nobody could distract us during the process? Yes, ma'am. Thank you. Now I'm going to wear my gloves. I'm gonna wear my gloves before I'm gonna start the procedure to my client. Now that I am done wearing my gloves, I'm going to clean the area that I'm going to inject to my client. Using my antiseptic alcohol pad, I'm gonna clean this from, again, you have to clean it from inside, rotation position, from inside to going out. I'll show you. This is from inside, and then you have to just roll it out and never retrace it. And also, now that while waiting to dry that antiseptic that I cleaned up to my client, I'm going to recap my syringe. Don't recap you can recap it with one hand or you can recap it like this, but when you cap it back, don't use two hands. Okay, with my ampule, I got the medication already. So what I'm gonna do here is 90-degree by using the Z-Track. I'm gonna do that to my client. Okay, if you're gonna inject, it's like you're just holding a pen, and then you gotta hold it like this. You gotta hold it like this, or like this, like Z-Track. But that's supposed to be in here. Okay, ma'am, are you ready? I'm going to inject you the medication now. Okay. Now, injected with 90-degree angle. And how you're holding the syringe is just like I'll put it back. It's just like you're holding a pencil. And it's more comfortable and it's easy. Now, if you have to ask the hospital if they had a protocol that you have to recap your syringe. If not, then you have to leave it that way and not recapping it. Never ever recap using both hands like this. You have to do it. You have to do it like this. And then you could do it like this. That's more secure for us, for our side. Okay. Now that I'm done injecting to my client, I'm gonna put this cotton balls, but never ever massage it. It's not necessary, and you could cover it with a bandage. Then discard. Another thing, take note that never throw all the needles anywhere. Like you have to be nice to those persons that they're gonna throw that garbage. We don't want that somebody will stab on that needle. That's not good. And then when I'm done doing all of that, I'm going to remove my gloves and discard on the proper place, and then clean my hands with my alcohol. And also, you have to record all the procedure from the date, the medication, the medicine, even the OR number, and don't forget to say thank you for your client. Thank you, ma'am, for coming today, and thank you for your cooperation. I really appreciate it. Do you have any question or any clarification regarding to that procedure? When the client say no, again, thank you, ma'am, and have a good day. And if ever you have any question or any clarification, just don't be hesitated to ask. Again, thank you, po. That's all for today's video for IM and 90-degree demonstration. Thank you.